Metabolic-associated steatohepatitis, or MASLD, is a silent epidemic affecting a large portion of adults. This severe form of fatty liver disease involves inflammation and scarring of the liver, which can lead to life-threatening complications like cirrhosis and liver cancer. Early diagnosis is crucial. However, MASLD often progresses silently, leaving many individuals undiagnosed until the disease is advanced. Linked closely with obesity and type 2 diabetes, the increasing prevalence of these conditions has fueled the rise of MASLD, posing a significant public health challenge. Effective treatments are needed to address the underlying causes of MASLD and to halt or reverse liver damage. Beyond individual health, the burden of MASLD has substantial economic implications, with significant healthcare costs associated with managing the disease and its complications. This strain on healthcare systems is a growing concern, making finding cost-effective treatments paramount to improve patient outcomes and manage the economic burden of MASLD. Recent research offers a glimmer of hope, with a study highlighting the potential of aspirin. This common over-the-counter medication could be a breakthrough treatment for MASLD. Aspirin is widely available and affordable, making it an attractive option, especially for widespread use if its efficacy is confirmed. The study investigated the impact of aspirin on liver health in individuals with MASLD, and the results were promising. They suggested that aspirin may improve liver health markers by reducing inflammation and scarring. This groundbreaking research has the potential to revolutionize MASLD treatment. Aspirin's affordability and accessibility could make a significant difference, particularly impacting underserved communities that often face barriers to healthcare access. This discovery could pave the way for a new era of affordable liver care. Metabolic-associated steatohepatitis, or MASLD, is intricately linked to metabolic dysfunction, which disrupts the body's energy regulation and affects how the body processes and stores fat. This metabolic imbalance creates a cascade of events that can culminate in liver damage. Understanding these underlying metabolic factors is crucial to develop effective prevention and treatment strategies for MASLD. One of the primary contributors to this metabolic dysfunction is insulin resistance. Insulin, a hormone that regulates blood sugar levels and allows cells to absorb glucose from the bloodstream, providing energy for the body's functions, becomes less effective in insulin resistance. This leads to elevated blood sugar levels, causing the pancreas to produce more insulin. This overproduction of insulin can have detrimental effects on the liver, which is responsible for converting excess glucose into fat for storage. When insulin resistance is present, the liver becomes overwhelmed with glucose, leading to an excessive buildup of fat in the liver, known as hepatic steatosis, the first stage in the development of MASLD. Obesity is a major risk factor for MASLD, characterized by an excessive accumulation of body fat, which disrupts the body's metabolic processes. Strongly associated with insulin resistance, obesity further exacerbates the risk of developing MASLD. The link between obesity and MASLD involves a complex interplay of factors including genetics, lifestyle, and environmental influences. Adipose tissue, or body fat, plays a significant role in metabolic health. In obesity, adipose tissue expands, leading to chronic low-grade inflammation that can spill over into the bloodstream and affect other organs like the liver, contributing to the development of MASLD. Furthermore, obesity can lead to changes in the gut microbiome, the collection of microorganisms that reside in the intestines, and play a crucial role in digestion and metabolism. Obesity can disrupt the balance of bacteria in the gut, leading to increased intestinal permeability, which allows harmful substances to enter the bloodstream and reach the liver, further contributing to liver inflammation and damage. Section 3, the diabetes connection. Type 2 diabetes is another significant risk factor for MASLD. It shares a close relationship with obesity and insulin resistance. In type 2 diabetes, the body either doesn't produce enough insulin or becomes resistant to its effects. This results in chronically elevated blood sugar levels, which have a damaging effect on various organs, including the liver. The liver plays a vital role in regulating blood sugar levels, storing excess glucose as glycogen, and releasing it when needed. However, in type 2 diabetes, the liver becomes less efficient at performing these functions and increasingly resistant to insulin. This leads to a buildup of fat in the liver, contributing to MASLD. Moreover, individuals with type 2 diabetes often have other metabolic abnormalities, such as high cholesterol and triglycerides, which can further contribute to the development and progression of MASLD. The presence of both type 2 diabetes and obesity significantly increases the risk of developing MASLD, highlighting the importance of addressing these underlying metabolic conditions to prevent and manage this liver disease. Section 1. A ray of hope. Recent clinical trials have ignited hope in the realm of MASLD treatment. These trials have focused on aspirin, a readily available and economical medication. Used for decades to alleviate pain and reduce fever, aspirin is now being investigated for its potential in combating liver disease. This is due to its anti-inflammatory properties, which scientists believe could be crucial in addressing the inflammation associated with MASLD. The clinical trial in question was a randomized, double-blind, placebo-controlled study considered the gold standard in medical research. The study involved a significant number of participants diagnosed with MASLD who were randomly assigned to two groups. One, receiving aspirin, and the other, a placebo. The use of a placebo group allows researchers to isolate the true effect of the drug being studied. The trial spanned several months, during which the participants were closely monitored. Researchers meticulously tracked various parameters related to liver health, including liver enzyme levels, which serve as indicators of liver damage, and the degree of liver fibrosis, which refers to the scarring of the liver. The participants were also regularly assessed for any potential side effects. Section 2. Aspirin's effect. A closer look. The results of the clinical trial were promising, offering a beacon of hope for MASLD patients. The group that received aspirin exhibited significant improvements in liver health markers compared to the placebo group. Their liver enzyme levels, which are typically elevated in muscle D, showed a marked decrease, indicating a reduction in liver inflammation. Furthermore, the aspirin group also displayed a slower progression of liver fibrosis. Liver fibrosis is a serious complication of muscle D, and its slowing down suggests that aspirin could potentially prevent or delay the development of cirrhosis, a late-stage liver disease. This finding is particularly noteworthy as there are limited, effective treatments for liver fibrosis. The study's findings suggest that aspirin's anti-inflammatory properties are at play. Inflammation is a key driver of MASLD progression, and aspirin's ability to curb inflammation appears to have a protective effect on the liver. This is further supported by the observation that aspirin also reduced levels of inflammatory markers in the blood of participants. While the clinical trial provided compelling evidence for aspirin's benefits in managing MASLD, further research is needed to fully elucidate the underlying mechanisms. Scientists are particularly interested in understanding how aspirin interacts with specific pathways involved in liver inflammation and fibrosis. This deeper understanding could pave the way for developing even more targeted and effective therapies. One area of interest is aspirin's effect on the gut microbiome. As previously mentioned, an imbalance in the gut microbiome is believed to contribute to MASLD progression. Some studies suggest that aspirin may help restore a healthy gut microbiome balance, thereby indirectly benefiting liver health. However, more research is needed to confirm this link and explore its implications. Another avenue of investigation is aspirin's impact on specific immune cells involved in liver inflammation. For instance, aspirin is known to inhibit the production of certain signaling molecules that promote inflammation. Understanding how these effects translate to the liver's immune response could uncover novel therapeutic targets for MASLD. The clinical trial investigating aspirin's effect on MASLD yielded promising results, particularly in improving liver health markers. These markers, acting as barometers of liver function, provided crucial insights into the potential of this readily available drug. Among the key markers monitored were liver enzymes, substances released into the bloodstream in response to liver damage. Elevated liver enzyme levels are a hallmark of MASLD, often indicating ongoing inflammation and cellular injury. The study revealed a significant decrease in these enzyme levels in the group receiving aspirin compared to the placebo group. This finding strongly suggests that aspirin actively combats liver inflammation, potentially slowing down or even halting disease progression. Another crucial liver health marker is the degree of liver fibrosis, essentially the scarring of the liver tissue. Fibrosis occurs when the liver attempts to repair damage, leading to the accumulation of scar tissue. Over time, this scarring can interfere with normal liver function, ultimately leading to cirrhosis. Aspirin's benefits in managing MASLD extend beyond its anti-inflammatory properties. Emerging evidence suggests that this multifaceted drug may also target other pathways involved in liver health. One such pathway is oxidative stress, an imbalance between the production of harmful free radicals and the body's ability to neutralize them. Oxidative stress contributes significantly to liver damage in MASLD. Aspirin, with its antioxidant properties, appears to counteract this oxidative stress. This antioxidant activity helps protect liver cells from damage caused by free radicals, further contributing to the drug's overall beneficial effect on liver health. Furthermore, aspirin seems to influence the way the liver handles fats. In MASLD, the liver accumulates excess fat, leading to a condition called hepatic steatosis. This fat accumulation is a key driver of inflammation and liver damage. Aspirin appears to improve the liver's ability to process and clear out these fats, potentially reversing or preventing hepatic steatosis. Section 3. Unraveling the molecular puzzle. While the clinical trial provided compelling evidence for aspirin's efficacy in MASLD, further research is crucial to unravel the intricate molecular mechanisms underlying its effects. Understanding these mechanisms will allow scientists to optimize aspirin's therapeutic potential and develop even more targeted therapies for liver disease. One area of intense investigation is aspirin's influence on gene expression. Genes hold the blueprints for protein production, and their expression dictates which proteins are synthesized in a cell. Aspirin appears to modulate the expression of specific genes involved in inflammation, fibrosis, and fat metabolism in the liver. By understanding which genes are affected and how their expression changes, researchers can gain a deeper understanding of aspirin's therapeutic targets. This knowledge could lead to the development of drugs that mimic aspirin's beneficial effects or enhance its efficacy. Furthermore, identifying these molecular targets could also pave the way for personalized treatment approaches, where therapies are tailored to an individual's genetic makeup. Section 1. Charting the course, future research directions. The promising findings of the aspirin study have opened up exciting new avenues for MASLD research. While the study provides a strong foundation, further investigation is crucial to solidify aspirin's place as a standard treatment option. Future studies need to address several key aspects to fully understand the drug's potential and optimize its use. One crucial area for future research is determining the optimal dosage of aspirin for MASLD treatment. The clinical trial used a standard dose, but it's possible that a lower dose could provide similar benefits with a reduced risk of side effects. Studies exploring different dosages will help establish personalized treatment strategies, maximizing efficacy while minimizing potential harm. Another important consideration is the long-term safety and efficacy of aspirin use in MASLD. The clinical trial focused on a relatively short time frame, and it's essential to assess whether aspirin's benefits are sustained over years of continuous use. Long-term studies are crucial to monitor for any delayed side effects and to evaluate the drug's impact on disease progression over an extended period. Section 2, bridging the gap from research to reality. Translating promising research findings into real-world clinical practice requires careful consideration and strategic implementation. Aspirin's potential as a mast LD treatment is undoubtedly exciting, but several factors need to be addressed before it can become a standard part of patient care. One crucial step is establishing clear guidelines for aspirin use in mast LD. These guidelines should outline patient selection criteria, optimal dosage regimens, and potential contraindications. Developing such guidelines will ensure that aspirin is used appropriately and safely, maximizing its benefits while minimizing risks. Professional medical organizations will play a key role in developing and disseminating these guidelines to healthcare providers. Furthermore, raising awareness about mast LD and the potential role of aspirin is paramount. Many individuals with mast LD are unaware of their condition due to its often silent progression. Increased public awareness campaigns can educate individuals about the risk factors, symptoms, and importance of early detection. This, in turn, can lead to earlier diagnosis and intervention, improving patient outcomes. Section 3, a future with aspirin, public health implications. The prospect of aspirin becoming a mainstay in mast LD treatment carries significant public health implications. Aspirin's affordability and widespread availability make it a particularly attractive option, especially for low-resource settings with limited access to expensive medications. If future research confirms aspirin's long-term efficacy and safety, it could potentially alleviate the burden of mast LD on healthcare systems worldwide. The drug's low cost could significantly reduce healthcare expenditures associated with managing mast LD and its complications, freeing up resources for other pressing healthcare needs. Moreover, aspirin's potential role in MASLD prevention should not be overlooked, given its known cardiovascular benefits. Aspirin is already recommended for certain individuals at risk of heart disease. If future studies demonstrate its effectiveness in preventing MASLD, it could be incorporated into preventive healthcare strategies, particularly for individuals with risk factors such as obesity and type 2 diabetes. This preventive approach could significantly reduce the incidence of MASLD, leading to a healthier population and a reduced burden on healthcare systems. Section 1, a legacy of relief, a future of promise. Aspirin, a medication renowned for its pain-relieving and fever-reducing properties, has long held a place in our medicine cabinets. Its journey from a simple willow bark extract to a global healthcare staple is a testament to its efficacy and versatility. Today, aspirin stands on the cusp of a new era, poised to potentially revolutionize the management of a silent yet widespread disease, metabolic-associated steatohepatitis, or MASLD. The recent clinical trial investigating aspirin's effects on MASLD has injected a wave of optimism into the medical community and offered a beacon of hope for millions affected by this often undiagnosed condition. The study's findings, highlighting aspirin's ability to improve liver health markers by reducing inflammation and slowing down fibrosis progression, have unveiled a promising new avenue for mast LD treatment, one that could transform patient care and alleviate the burden on global healthcare systems. Aspirin's potential impact extends beyond its therapeutic benefits. Its affordability and widespread accessibility make it a particularly attractive option for addressing health disparities, particularly in low-resource settings where access to expensive medications is often limited. This potential to bridge the gap in healthcare access underscores the significance of this research and its implications for global health equity. Section 2. Aspirin's potential, a triumph for public health. The potential of aspirin to combat MASLD represents a significant triumph for public health, particularly in the face of rising obesity and type 2 diabetes rates. These metabolic conditions are closely intertwined with MASLD, forming a complex web of interconnected health challenges. Aspirin's ability to address both the underlying metabolic disturbances and the resulting liver damage positions. It is a powerful tool for tackling this growing health concern. If future research confirms its long-term efficacy and safety, aspirin could become a cornerstone of MASLD prevention strategies. Imagine a future where a readily available, low-cost medication can help curb the tide of this silent epidemic, preventing countless cases of liver disease and reducing the strain on healthcare systems worldwide. This vision, while ambitious, is within reach, fueled by the promising findings of this groundbreaking research. The implications extend beyond the realm of healthcare. By preventing and managing MASLD, we are not only improving individual health outcomes, but also fostering a healthier, more productive society. A healthier population translates to a stronger workforce, reduced healthcare expenditures, and a brighter future for all. Section 3. Towards a brighter, healthier future. As we stand at the precipice of a new era in MASLD management, it is imperative to acknowledge the significant strides made in understanding this complex disease and the innovative research paving the way for effective treatments. The journey to unraveling the mysteries of MASLD has been marked by tireless efforts from researchers, clinicians, and patients, all united in their pursuit of a healthier future. The recent aspirin study is a testament to the power of scientific inquiry and its potential to transform human health. This discovery, however, is not the end goal, but rather a stepping stone towards a future where MASLD is no longer a silent threat, but a manageable condition. Continued research is crucial to fully elucidate aspirin's mechanisms of action, optimize its use, and explore its potential in combination therapies. The path forward requires a multifaceted approach, encompassing further research, the development of clear clinical guidelines, and widespread public awareness campaigns. By fostering collaboration among scientists, healthcare providers, policymakers, and the public, we can harness the full potential of this discovery and pave the way for a brighter, healthier future for all.